In this video, find out how to treat shingles with a high success rate. Who are the doctors who pioneered this approach, what dose to take for successful treatment, and links to 15 scientific articles for more information. Shingles can be cleared up by using a safe, convenient, inexpensive, non-prescription treatment of vitamin C. Vitamin C is antiviral and antitoxin, and inactivates the virus that causes shingles. If you have shingles and want relief, you can try this. Go to a health store and buy a large bottle of 1000 milligrams vitamin C tablets. Begin when you wake in the morning by taking 3000 milligrams of vitamin C every 30 minutes and continue until you have a single episode of loose stool, not quite diarrhea. If you haven't had loose stool after 15 hours on this dosage, increase the vitamin C to 4000 milligrams every 30 minutes. After you have a loose bowel movement, reduce the dosage to 2000 milligrams of vitamin C taken every hour. You will quickly find the dosage that is right for you. Adjust the dosage of vitamin C downward to stay below the dosage that will cause loose stool, and adjust it upward to relieve shingles symptoms. Continue the oral vitamin C therapy until the shingles disappear. It sounds too simple to be true, doesn't it? But it works in the majority of cases, as recently reconfirmed by Thomas E. Levy. Sometimes it's necessary to take vitamin C intravenously, or IV. For massive shingles outbreaks, much higher concentrations of vitamin C in the blood can be achieved intravenously than when taken orally. As early as 1950, the medical literature reported that one physician had confirmed intravenous vitamin C curing shingles in 327 patients within 72 hours. Ask your doctor if he or she offers vitamin C IV, and if not, ask friends or search the internet to find a doctor or facility that does offer this treatment. Vitamin C blood serum levels of individuals fall during periods of high stress and they develop subclinical scurvy, depleted vitamin C levels. This situation can set the stage for a shingles attack. With vitamin therapy, at any given quantity, frequently divided doses are more effective than one large single dose. Vitamin C and shingles. An opinion by Thomas E. Levy. The pharmaceutical industry, and many doctors appear to be making great efforts to get as many people as possible vaccinated against shingles, even if such an intervention was highly effective in preventing shingles, which certainly has not been shown to be the case. The information below should make it clear that such vaccinations are unnecessary. The side effects that would be suffered by a significant number of individuals need never occur in the first place. The real problem is that what is discussed below generates relatively little income for anybody in the healthcare industry. Regardless, you need to decide for yourself. Shingles is an infection resulting from the varicella zoster virus, usually manifesting in areas supplied by spinal nerves, known as dermatomes. More commonly known in medical circles as herpes zoster, the infection is typically characterized by a blistering skin rash of extraordinary pain for most individuals. The initial infection with the virus is usually remote from the shingles outbreak, typically occurring in childhood when chickenpox is contracted. For years, the virus remains latent in nerve cell bodies or autonomic ganglia. It is when the virus, for unclear reasons, breaks out of these storage sites and travels down the nerve axons that shingles occurs. Left to itself, along with mainstream therapies that include analgesics, antiviral agents like acyclovir, and corticosteroids, the rash will generally resolve in 2 to 4 weeks. The pain is generally lessened little by analgesics. Some unfortunate individuals can experience postherpetic neuralgia, a syndrome of residual nerve pain that can continue for months or years following a shingles outbreak. The clinical response of shingles to vitamin C therapy is decidedly different from its response to traditional therapies. While there are not many reports in the literature on vitamin C and shingles, the studies that do exist are striking. Frederick Klenner, MD, who pioneered the effective use of vitamin C in a wide variety of infections and toxin exposures, published the results of his vitamin C therapy on 8 patients with shingles. He gave 2000 to 3000 milligrams of vitamin C by injection every 12 hours, supplemented by 1000 milligrams in fruit juice by mouth every 2 hours. In 7 of the 8 patients treated in this manner, Complete pain relief was reported within 2 hours of the first vitamin C injection. All patients received a total of 5 to 7 vitamin C injections. Having had shingles myself years before I knew of the efficacy of vitamin C therapy, I can assert that this is nothing short of a stunning result on what is usually a painful and debilitating disease. Furthermore, the blisters on Dr. Klenner's patients were reported to begin healing rapidly with complete resolution within the first 72 hours. As with other infectious conditions, Dr. Klenner hastened to add that treatment needed to continue for at least 72 hours as recurrence could readily occur, even when the initial response was positive. Dr. Klenner also found a similar regimen of vitamin C just as readily resolved the blistering lesions of chickenpox, with the recoveries usually complete in 3 to 4 days. Similar clinical response by chickenpox and shingles to vitamin C is further evidence, albeit indirect, that the chickenpox virus and the later appearing herpes zoster virus are the same pathogen. Even before Dr. Klenner's observations were published, another researcher reported results just as astounding when measured against today's mainstream therapies. In 1943, Danow reported success with 14 shingles patients receiving vitamin C injections. In another study, complete resolution of shingles outbreaks was reported in 327 of 327 patients receiving vitamin C injections within the first 72 hours. While all of this data on vitamin C and shingles is quite old, there is an internal consistency among the report in how the patients responded. Until further clinical trials are conducted, these results stand. They clearly show that vitamin C should be an integral part of any therapeutic approach used on a patient presenting with shingles. Vitamin C and viruses. Vitamin C has a general virus inactivating effect, with herpes viruses being only one of many types of virus that vitamin C has neutralized in the test tube or has eradicated in an infected person. As with the inactivation seen with other viruses mixed with vitamin C in the test tube, in vitro, 2 early studies were consistent with the clinical results later seen with vitamin C in herpes infections. Vitamin C inactivated herpes viruses when mixed with them in the test tube. The most important factor in the treatment of any virus with vitamin C is to give enough for a long enough period of time. Certain chronic viral syndromes do not promptly resolve with vitamin C administration, but there is yet to be an acute viral syndrome that vitamin C cannot resolve promptly, unless the patient already has extensive tissue, organ damage and is literally only moments away from death. Vitamin C therapy can never be considered a failure in an acute viral syndrome until multiple forms have been used in large doses together. While a majority of acute viral syndromes will rapidly resolve with properly dosed vitamin C of any kind, resistant cases need to be subjected to a multi-pronged approach to vitamin C administration. Such a regimen can include, but not necessarily be limited to, 1,000 to 5,000 milligrams of liposome encapsulated vitamin C orally, daily, bowel tolerance doses of vitamin C as sodium ascorbate orally, daily, 1,000 to 3,000 milligrams of fat-soluble ascorbyl palmitate orally, daily, intravenous vitamin C, 25,000 to 150,000 milligrams per infusion, depending on body size, as frequently as daily, depending on the severity of the infection. Vitamin C accumulating inside viral particles can rapidly destroy viruses. By that approach, the spike of the bacteriophage virus is laden with iron, and the focal Fenton reaction is probably how it penetrates its host cell membrane. Viruses accumulate iron and copper, and these metals are also part of the surfaces of viruses. As such, wherever the concentrations are the highest, vitamin C will focally upregulate the Fenton reaction and irreversible viral damage will generally ensue. Fenton activity and its upregulation is the only really well-documented way by which viruses, pathogens, and also cancer cells can be killed by vitamin C, and it is the stimulation of this reaction by vitamin C that makes it therapeutically effective in resolving many infections and cancers. Vitamin C helps resolve infections of all varieties, but its effect on acute viral syndromes are especially dramatic and prompt, and it should always be part of any treatment protocol for an infected patient. Dr. Thomas Levy is a board-certified cardiologist as well as an attorney. He is the author of several books, including Curing the Incurable, Vitamin C, Infectious Diseases, and Toxins. Subscribe and like below and check out our next video.